Thank you for coming by to talk to our students. We have some students online as well.
Okay, that's great. Thank you for being here and thank you for the invitation. I really appreciate it. Thank you to Monique and Dale for setting everything up.
Thank you.
So I do have some postcards if anybody would like to learn a little bit more about the center we have. Here and up afterwards. So maybe I could start by asking you, what do you think about when you hear the word food insecurity?
Poverty, public health.
Access or lack of access.
Access.
I also see like a dissociation between where food is made and how like connect.
It's all of those things. There are some formal definitions and there are also some, misconceptions about food insecurity. So I think I'm going to start by what is food insecurity? And there are various definitions, right? U.S. Department of Agriculture, WHO, FAO, a whole bunch of definitions. So I like some more than others. So these are two that I think really get to the crux of food insecurity, what it is, a social condition of limited or uncertain access to adequate food. And a person is food insecure when they lack regular access to enough safe and nutritious food for normal growth and development and an active, healthy life. I think what's key here too is the notion of availability, safe, nutritious, and also I would add socially acceptable food. And if it's available, do people have access to it? And do they have the knowledge and resources to utilize it? And I'll talk more about dimensions of food security in just a minute. But often when people think about food insecurity, and it's a relatively new concept. Back when I first started doing research on the topic, it wasn't formally defined, and I was looking at things like seasonal food scarcity. But often when people think about it, they think about hunger, right? And there are formal definitions of hunger: feeling of discomfort, weakness, or stomach pains caused by a lack of food, a sensation resulting from a lack of food. Thing is, certainly if you're chronically food insecure, if you're chronically hungry, you're food insecure, but you don't have to be hungry to be food insecure. And a lot of the food insecurity that we're looking at, for example, in the US, is really related to what people are eating, and it's often it's overconsumption, high caloric, highly processed foods that are not nutrient dense, and we'll talk more about the reasons for that in just a minute. So food insecurity occurs with or without chronic hunger. Now, of course, people use the tagline of hunger all the time, because that's what pulls on the heartstrings. That's what gets your attention. So I do work with food banks at food pantries, and they often emphasize hunger. And yes, certainly there are folks who are hungry, and that shouldn't be. We're thinking about food as a human right. Certainly in a country that is food rich and wealthy, there should be no one that is going hungry. But the bigger issue, again, is really quality of diet. So there are these requirements to be food secure, and I mentioned a few of them already. One is availability. So there needs to be a reliable and consistent source of quality food. It's safe, nutritious, right? And importantly, socially acceptable. So in my experience of doing research, people may get food, as part of food assistance, but they don't identify with the food. They don't know what to do with the food. It's not part of their identity. So that's an issue. Then access, people have sufficient resources. Again, do they have the money to get that food, to purchase that food? Do they have the ability to produce that food, right? So it needs to be available, it needs to be accessible, and they need to be able to utilize it. So do they have the knowledge of what foods are healthy and nutritious, right? Do they have the knowledge about food preparation? Do they have the resources, even things like proper refrigeration, right? Utensils, a stove. And believe it or not, there are a lot of folks who don't have one or more of those things. And there is also a biological component to utilization in terms of nutrient absorption. In order for there to be food security, all of these other dimensions must be stable over time, right? If any one of them is deficient in any way, then that could result in food insecurity. So causes of food insecurity, well, someone mentioned poverty. Certainly that's a significant one. But I would say too, there are a lot of folks now and even in the past who, are living above the poverty line. And that's an artificial line, by the way, as we know, who are food insecure. And in fact, what we're finding is that a lot of what would be considered middle income households are food insecure. There was a study done by United Way, and they have this acronym. It's called ALICE. Is anybody familiar with ALICE? It means asset limited, income constrained employed. So this kind of shatters the stereotype of, someone who's food insecure. So these are folks who, they may own their own house. They're working one or more jobs. They're paying rent. They're trying to pay their utilities, but they're food insecure. And the research shows that often the first thing that is compromised when people are living on a very tight budget is food. People will purchase less expensive food and prioritize things like the rent, mortgage, medicine. And often, of course, that less expensive food is again, energy dense, nutritionally devoid. Right? So poverty, war and conflicts, that's a big one, of course, throughout history, but especially now, if we think about the war between Russia and Ukraine and how that had the great potential and did for a while to affect food availability across the globe, because Ukraine is a major producer of grain. Of course, what's been going on in Gaza and a high level of malnutrition there. So, and often, in conflict, in war, food is used as a weapon, right? As a leverage point. Right? Climate change and natural disasters, and I know I don't need to tell this group about that, right? But we know that climate change is having an impact on the ability to produce food and what kinds of food is being produced, and even the distribution of that food. And it's also tied to not only, it's tied to water too. So I'm working on a paper now looking at the intersection of both food and water security. And they're intimately tied. And researchers are saying more and more, we have to look at these things together. So certainly climate change, social inequality, I've alluded to that already. When we look at food insecurity globally, and in the US, we do see racial and ethnic differences. And I know we're not supposed to talk that much about that here, but that's the reality, that's the fact. And I'll show you some data on that in a minute. Poor governance and infrastructure, and we have some really good data on that too. And of course, unemployment, food waste is a big issue too. So food left on the fields, 800 million pounds of produce is left on the fields in Florida annually. The foods that don't make it to the market because the supermarkets won't buy them, they may be blemished, right? There's also food waste, at the level of the household too, and where people get food, they don't eat it because they're not used to it, or they don't know what to do with it. We did a study a few years ago. We actually did household visits, and no great surprises here, but we found out a lot of people they would, they'd get eggplant and they didn't know what to do with it. And it wasn't that they didn't want to try it, they just didn't know how to prepare it. So there's an opportunity to affect knowledge and that dimension of utilization. So here's some data on global food insecurity, and everybody was hoping, and we're not out of the pandemic yet, but certainly, we're not as greatly affected by it as we were, that the food insecurity rates would go down as the economy improved, but that didn't happen. So in 2023, about 780 million people food insecure worldwide. And again, that includes, folks who are chronically hungry, but also that other really large group. So we have this phenomenon where we have food insecurity and dual burden malnutrition, where you have both the kind of coexistence of undernutrition, nutrient deficiencies, micronutrient deficiencies, and in a segment of the population, and another segment of the population where food, there's overconsumption and high caloric intake, energy dense foods. So there's growing overweight, obesity, and these diet-related diseases. India is a really good example of this going on now. Very strong economy, growing middle class, but also a lot of poverty. So the numbers have been inching up. There has been a deterioration of the global food environment, and a lot of that is related to food price inflation. And just today, there was data out on inflation. It's back up to about 3%. It's going down in the U.S. It's up again, and I didn't hear about the breakdown and how much of that inflation is attributed to an increase in food, but we do know avian flu is affecting the price of eggs, and of course milk is also, cost of milk is up, and probably other essentials. Supply chain disruptions that really came from COVID-19, and that really was a shock to the system, and they persist. Climate change and conflicts. And this is according to the World Food Program and World Bank, very recent data. So you look at the data over time, the population undernourished through 2022, and that's 2023 data. So it's gone up significantly. And this is the kind of percentage of world population. You can also look at this US. So there is this long-standing problem of food insecurity in the U.S. And it often goes up and down with the economy. So the U.S. government started collecting food security data in the 90s. They had validated instrument that they used, and then there are all kinds of other studies done on it. And, we see it, the orange line represents households with children, and the yellow line, just all households. So you can see in 28, 29, it peaked. Well, about 21% of households with children were food insecure, and that was during the Great Recession we had. Then it came down, and then it went back up during COVID, and the numbers are showing an increase in the most recent data. So I think about 13.5% of the US population is food insecure as of the most recent data from the USDA, right? So US is slipping in food security. Again, a wealthy country, food-rich country. There was a study done by The Economist back in 22, and US ranked 13 out of 113 industrialized countries. You would, at least I would expect it to be, the top 1, 2, or 3 in terms of food security. And these are some of the key things that were identified where the US needs to improve in terms of food insecurity or food security. There are issues around food availability. Again, are those safe, nutritious, socially acceptable foods available in all communities? Is it accessible? And people living in a food desert where there isn't a market nearby, that's an issue. Food food swamps, which refer to, high concentrations of fast food joints. So a really good example of that is Fletcher, going west, right? Just a ton of fast food joints. I think there's a Walmart there, so I think they have a food market. Probably has produce, but definitely it's a food desert, food swamp there, and of course there's a lot more poverty in that area as well. Sustainable food production, the U.S. needs to do a better job on that. And there needs to be a national food security strategic plan. There isn't one in place. In 22, the White House held a hunger summit, and it was a really good white paper that was written based on that summit with a set of, an action plan and some really good recommendations. Of course, everything, with the new administration, we don't know how much support there is going to be for those for that strategic plan moving forward. This map on the right shows food insecurity by state, and the darker the color, the higher the food insecurity. And as expected, the higher rates of food insecurity tend to be found in the Southeast. There are exceptions to that. So Maine has a very high level of food insecurity, but places like Mississippi, Alabama, Louisiana, Florida to a lesser extent, Arkansas, those states have the higher levels of food insecurity compared to some other regions in the U.S. And in part, that's due to government policy, state policy, that, does or does not support assistance. So barriers to food security include low income, high unemployment, and inadequate access to affordable and nutritious foods, limited transportation options, social isolation. That's a big issue in a state like Florida, where we have a large senior population, and we've done some work, both research and program evaluation on programs aimed at older adults. Disability is also another one. These are the high-risk groups. I mentioned Alice households, minority and other vulnerable groups. Believe it or not, college students too are very high risk of food insecurity. It ranges from 10% to over 50%, depending on the college, university, and the location. And I can tell you, research has been done at USF, right? We published on that. Of course, we don't name USF in this. But, according to the data, this was both secondary and primary data. We're talking about between 40 and 50% of USF students who responded said they had been, food insecure, or they missed a meal or meals for at least one day during the previous 12 months. And quite a few of those students were they had housing insecurity too. Right? So it is an issue, and yes, it's great. We have feedable pantry, but I can tell you that the demand outstrips what resources are available for feedable. So here's some of that data again on race and ethnicity, right? If you look, this is from 2010 to 21, African Americans, Asian, Hawaiian, Pacific Islanders, Latinos have higher rates of food insecurity compared to their white counterparts, right? And it comes down to issues of inequality and inequities. Those, you can pull out subgroups, right, in any of those populations and see even higher or lower rates of food insecurity. So why is this? Well, before I get to, obviously, food is a human right, it's important, but it's also connected with health and well-being. But food insecurity is experienced in different ways. And it depends on the intensity, from mild to severe, right? And it's measured, right? There are different ways of measuring it, both quantitatively and qualitatively. The main scales that are used today are experience-based scales. So you're asking people about, for example, did they have enough food in the previous whatever it is? Did they have to skip meals? You know, and there is a scale that ranges from a six question to an 18-question scale that is used in the US to look at the intensity of food insecurity. You could look at food insecurity as being chronic, transitory, seasonal, depending on the population. The timing, and this is really important here, we know the consequences of food insecurity may be more or less severe depending on where the individual is in their life course. So if we're talking about pregnant women, if we're talking about the third trimester of pregnancy, if we're talking about adolescence, where energy and nutrient needs are higher, if there is food insecurity and it's, severe, it can have an impact on things like growth, development, and health. The food insecurity is affected by social capital, social support. You have a good support network that you may be buffered from food insecurity. Also, individual agency, the ability to react, resiliency, right? All of these things have an effect on how food insecurity is experienced. And we do a lot of research, and I'm in the anthropology department, and yes, I'm interested in things like the impacts on growth and development and health, but I really also do a lot of qualitative research to look at things like social support and the ability of people to respond and react to food insecurity. So it's also food insecurity is embodied, right? And I kind of mentioned this already, but food insecurity is depending on, where and the kind of food insecurity you have, it's associated with undernutrition. So lack of calories, lack of protein, lack of low calories and protein, micronutrient deficiencies, those sorts of things. It's also associated with, again, overconsumption of energy-dense foods. I mentioned double burden malnutrition. It's also related to diet-related diseases, both infectious diseases. We know there is a relationship between nutritional status and immune function. And there's been a lot of research. They even call it the nutrition infection complex. So if you're food insecure and you're malnourished, it compromises your immunity and you may be more susceptible to infection. You all also may engage in practices that increase your risk for infection too. If again, you're trying to make money or find ways to get food. It's also associated again with chronic non-communicable diseases, and that's what we see a lot of in the US, higher rates of food insecurity among people with type 2 diabetes. Psychosocial, anxiety, depression, stigma, shame, sadness, that shouldn't be eating, it should be eating disorders. Really, we did some, and I'll talk about it in a few minutes, some really interesting research with teens on food insecurity, how they perceived it, how they tried to manage it, and then recommendations they had. This was in Pinellas County. It actually resulted in some changes in school cafeteria policies, which I'll talk about. There's psychobiological effects. It's been long known that malnutrition is associated with cognitive disability, and the timing is really important. So I was hear about kids who go to school hungry, and that does affect their learning and their academic performance and can affect the cognition as well. And there's really interesting recent research on the microbiome, right? All of the microbes in our gut and throughout our bodies that are important for food processing. And we did a very small study on college students to look at the microbiomes of food insecure college students and food secure college students. And there were differences in the microbiome. are not sure what they mean, this is a new area of research that not only us, but lots of other folks are doing. But there are these differences in the gut microbiome between food secure and food insecure college students. And other research shows that too. And it's not just at one point in time. Really interesting research out of Puerto Rico showing differences in infant microbiomes between moms who were pregnant during Hurricane Maria, who were food insecure, and moms who were pregnant during Hurricane Maria who were food secure. And they found that the infants had different microbiomes. Yeah. Whether or not that has an impact on health is still needs to be determined. But there is some data that suggests that the microbiome may affect things like immunity and cognition. So there's all of this accumulating research, and back in early 2024, there's a position paper that was published in JAMA Pediatrics, basically saying that food insecurity is a toxic stress and that food insecurity permanently rewire the brains of children. Right? So this is in JAMA, right? Medical journal, very, high-level journal, but I think it raises the visibility among medical practitioners that food insecurity is an issue. So, and I've met there is this bidirectional relationship, at least according to the research, between diet-related diseases and mental health. So, associated with food insecurity. And there's a list of these types of conditions and how they're often also associated with depression, anxiety, different types of stress, substance abuse, and eating disorders, and even PTSD. More research needs to be done on this, but it's not just looking at food insecurity and physical health, but studies are looking at food insecurity with physical health and mental and psychosocial health. Now, I just wanted to mention that there is this, okay, yeah, we're good. Syndemic model of health, which actually emerged out of medical anthropology in the 1990s. And I'll read the definition to you and talk a little bit more about it. So it's the concentration and deleterious interaction of two or more diseases or other health conditions in a population, especially as a consequence of social inequity, social disadvantage, unhealthy living conditions, and unjust exercise of power. Okay? So it is really, the idea is that living in these sorts of conditions lead or can lead to the interaction of two or more diseases or conditions that become amplified. So this is kind of a graphical depiction of it. You have these disparities going on. These two diseases interact, and then the disease is enhanced. And this theory, this framework of syndemics, was based on research done by Merle Singer, a medical anthropologist, who I had the opportunity to work with, which is during this time. So it was really one of the reasons I think that I really think this is a good framework is because I, kind of measuring these syndemics. And what he was looking at with his team was the kind of intersection of substance abuse, HIV, and violence. This was in Hartford, Connecticut. And he said these things interacted and made worse result of these interactions. Syndemics really is caught on now. So It's looking at these interactive effects under different social conditions. So it's reported on in Lancet, and the CDC. Not easy to study, especially the interactions, but there is a solid base of research that suggests that it exists. So for example, we see, in some places in the world, the rates of HIV/AIDS are really, really high as compared to other places. And if you look at the syndemic interactions, that might explain it. So this is a model that we use to look at the food insecurity, diet-related disease syndemic. And this is something we published a couple of years ago. And what it takes into account, and I won't go into a whole lot of detail, so I want to make sure I get through the rest of the presentation, is, the starting point is, there's some sort of social inequality or inequity in a particular setting, environment, that results in food insecurity. And you can see there are those three dimensions of food insecurity that I mentioned before: availability, safe, nutritious, socially acceptable food. Do people have access to it? Do their resources to buy it or produce it? And do they have the knowledge and tools to prepare those foods? If they're food insecure, obviously they don't. That could lead to increased stress, which results in food instability and people eating more inadequate foods that may be unsafe, socially inappropriate. And then there is this theory from evolutionary biology, known as life history, where there are these trade-offs through the life course between energy and nutrient needs and what is available in the environment. So that could lead to a change in health and nutritional status, which can result in these or increase the risk for these diet-related diseases. And depending on where an individual, if we're talking about an individual, when this chronic food insecurity exists, depending on where they are in the life course, may have a greater or lesser impact on their health and well-being. Yeah.
Gorgeous. Do you remember off the top of your head the title of the paper?
I can give it to you.
Thank you.
So, really interesting study that goes to this issue is one done in Brazil a few years ago, showing that food insecure women and teenage girls from Brazil who they were less well off, were much more likely to be overweight or obese compared to their food secure counterparts. Didn't find that with young kids, but did find it with teens. And that's quite interesting. Okay? But again, depending on where an individual is in the life course and the intensity and how long the food insecurity lasts may or may not have a health impact. So let me talk with the last few minutes about our center. The center was established in 2020. I've been doing food security research for even before it was called food security and food insecurity. So going back, 25, 30 years. And in fact, my PhD research was on seasonal food scarcity in the highlands of Lesotho in Southern Africa, small, tiny country, completely surrounded by South Africa. And what I was interested in is how different types of households, and basically compared female-headed households with male-headed households. And in Lesotho, at least at the time, a large proportion of males were absent from Lesotho. They were working in South African mining and agriculture. This was towards the end of apartheid, and there was forced separation of family. And I wanted to see how these households manage seasonal food scarcity, food insecurity. And I wanted to see how that was embodied in both mothers and children. And lo and behold, we found actually that the women, and this is a very patriarchal, patrilocal society. We found though that the women in their own households did better. Were much more stable in seasonal nutritional status. So we followed them over, one complete annual cycle. And the reason being was, one, they had a lot more autonomy to make decisions. Two, in Lesotho, women tend to be better educated than men. So it's often young men, boys will they'll work as shepherds, or they'll go work in or they used to anyhow, work in mining or agriculture. Whereas young women would go and get more education and work. They had jobs, they would work for government or businesses. So these moms who had more decision-making control were less tied to risky agriculture. This was in the mountains of Lesotho, where agriculture is really risky. Where showed more stability in their nutritional status and their children as well. So anyhow, so I've been doing this for a long time. And when I came to USF, started doing some research and back in 2016, USF and Feeding Tampa Bay. Are you familiar with Feeding Tampa Bay? It's the major food bank that covers 10 counties in West Central Florida. We signed an MOU to work together. And we launched the center in 2020, and the center was recognized by the Board of Governors, who oversees the university system, as a statewide center in 2020. So we haven't been around that long, but we've actually been doing work for a while, and I want to talk a little bit about the work we do. So this is our mission: eliminate food insecurity using research, education, and innovative approaches that increase access to affordable, nutritious foods and result in healthier communities. So it's a bold mission, right? But we think you have to be bold. These are our areas of inquiry and action. So a lot of what we do is translational or applied research. And there's some basic research that we do, but a lot of it revolves around program development and program evaluation. So we'll work with a Feeding Tampa Bay, or we'll work with a healthcare provider to develop a food prescription program, right? And then we'll test it and see if it's effective, right? Raising awareness through education. So we work with other organizations on symposia and workshops, reporting to stakeholders and policymakers. And maybe the most important thing is training this next generation of researchers, leaders, and advocates. So we have had over 40 students work on various projects. Some of them completed theses, MA and PhD dissertations, and a high percentage of them we've been able to pay them, which is really important. These are, again, our goals. So today we have 15 faculty who are affiliated with the center, and they represent 7 of the USF colleges. So we try to be interdisciplinary, and that's not always easy to do, but we strive for that. And we also work with 3 other USF centers and institutes, including lifestyle medicine, and microbiomes. And presently we have, during the last few years, these are the community partners we've worked with. Everything from very small agencies like Where Love Grows that provides after-school cooking classes to preteens and teens, to Feeding Tampa Bay, even Feeding America. We've done some work with. We're working with the county now. Homegrown Hillsborough is an effort to bring together all of the stakeholders in in the county food system. So we help them with some data collection and analysis. So to date, we have more than 20 projects that actually date back again, that, prior to the establishment of the center. It says 35 students. I just did a new count. We're over 40 now, undergrad and grad students. Most of our funding is through grants. So we have funding or from the USDA. We're very concerned about funding from federal, the federal government. But also we have a lot of, we have several contracts too. It's really interesting to, some of those contracts are with our main partner, Feeding Tampa Bay, but the funding is actually coming from health insurance providers like Humana and Florida Blue, who have recognized the fact that these, for example, food as medicine, food prescription programs or prevention. And it's, I'll describe one of those programs in a minute, but it's an ethical issue, but maybe more importantly for them, it's a bottom line issue. It's less expensive to ensure that a household is food secure rather than them showing up at the ER at home. So we're getting the funding has actually been really good from some of these private foundations. I mentioned theses and dissertations that students have written, peer-reviewed articles, presentations. In fact, most of the peer-reviewed publications are actually led by our students. And that's important for their training and for getting jobs after they graduate. Technical reports and a fair amount of media coverage too of different projects. And this is a truck that's owned by Feeding Tampa Bay. It's called Groceries on the Go, and they actually provide food in different neighborhoods. So you can get the schedule, or there's an app to look at this and find out where the fresh produce is going to be, and then you can go and pick it up. So examples of projects, I mentioned FoodRx. We did a project that started during COVID-19, lots of challenges because of that. It was with Feeding Tampa Bay and Ibarra Health in Pinellas County. Basically, these were adults who were coming to the federal health clinic. A lot of them didn't have insurance or they were underinsured, right? And they were screened for food security. And if they were food insecure, they were offered the opportunity to participate in this FoodRx program. It was on-site food pantry, and they were given $100 a month in food vouchers to use the Groceries on the Go van truck. So basically, they had food that they can pick up from the two clinics and $100 in vouchers. And we tracked them over time. I think I have the results of some of the main findings. I'll talk about that. Health Buddies is a program that's going on right now. It's with an organization called Seniors in Service, also Feeding Tampa Bay, and then this for-profit company called Fit Life Foods that provides nutritious meals, medically tailored meals to older adults. Many of them are homebound. In addition to that, we have student volunteers, mostly from USF, who contact these seniors, these older adults on a weekly basis and just talk with them. And that's a really important component of the project in addition to the meals. I mentioned Homegrown Hillsborough and some of these other projects, which if you're interested, I could talk about. So this was FoodRx. Again, this was a collaboration, Feeding Tampa Bay, Ibarra Health, and the funder was Humana, right? The health insurance provider. So we wanted to really have these goals: improve patients' food security, to enhance management of chronic health conditions. There were 2 community clinics, 330 patients. Of that number, about 203 enrolled in the study. We're given these vouchers, and again, over time, we followed them for about 12 months. And we found that the more frequent individuals, the patients, the participants redeemed food either at the clinic or at groceries on the go or both. We saw an increase in food security status. For folks who had type 2 diabetes, it was a small but significant reduction in hemoglobin A1C. A reduction in blood pressure, systolic blood pressure was a significant, again, small but significant reduction in stress levels too. High client satisfaction. And what people told us too is that, this extra money, that these vouchers freed up money that they needed to use for other things like bills.
What was the period of time that this was
It
completed?
was over a 12-month period, right? And it was attrition. It was difficult to do follow-up. So, but definitely we did find that the frequency and the more people redeem food, the better the outcomes. And then I'm going to end here. This is the 15th Street Farm Nutritional Education Program. This is the one I mentioned before. We're working with urban farm consultants and schools. So there's a farm in St. Pete called the 15th Street Farm. It's about 1 acre. And they've been around for a while, and they bring middle schoolers out to the farm. But we also, as a result of this funding, we hired gardening and nutrition educators who would go to the schools and teach the kids how to garden and about nutritious food. That's the curriculum focus. And I think one of the most important outcomes, and we're still not quite done yet, is that it's very important for, or at least from the perspective of these middle schoolers, the connection with, growing food and consuming food, right? So we teach a little bit about soil, plants, soil and plant health can result in improved human health. And, the kids would talk about just being in this space and how important it was for them to grow their own food. And it helped them in terms of working in teams and leadership. We had them do a really interesting photo voice project where they took pictures of the, whatever they wanted and of the farm, and then they provided quotes and really beautiful quotes about, everything from contemplating life and death to this really helps me clear my head just by being out in open air and doing this gardening. So if I could show this video. Could be a way of, sometimes you have to. Not only, it's usually there's you have to enable the presentation to show it. Oh. That's really only 45 seconds. Yeah, yeah. I can definitely that I can send it to you.
Guess the subject, but I got this weird email about the GI.
It's all right. I'll share with you. So anyhow, it's a short video. What I like a lot about it is the kids are talking about things like the importance of, having bees to pollinate. They talk about trying food that they haven't tried before. The hands-on activities, I think, are so important, and that connection that, with nature, which is a very human connection that we've lost, is important. So I'm going to end here. We're a little bit over time, but if anybody has any other questions, yeah.
Is there like a follow-up with like the kids, like after they've been there, like, and they like, maybe like a year later or 2 years later?
Yeah, yeah.
Follow up?
Well, the funding is ended. We're writing up the final report. We're looking into renewing it, but things are really right now up in the air. And a lot of it comes down to, I think, certainly the intent is really good, but we have to be really careful about the language we use, considering what's going on with the new government.
Okay, you mentioned in your presentation that those are numbers from US, yeah, a rich country, basically. I'm coming from a developing country, and I have a very sad story trying to attack food insecurity. The company where I used to work had field operations, oil field operations in a very, very poor area. And a lot of years ago, they decided that a lot of food that was available after all engineers and all employees from the company, it was not used. They decided to give the food to the community. However, some months later, they received a legal claim associated to some damage that the community suffered. I think it was a stomach ache or something like that, associated that the company gave them the food. So, of course, the consequence was the food gift was canceled at that time. So no more food for the community. So have you studied or do you have any idea how to deal with that kind of problem? Basically, I don't know, that is cultural. I think trying to get something very small, of course, all the community lost. Do you know how to manage that kind of things or any idea to manage?
Well, I mean, it is complicated. And I think, in my experience, is making sure that communities are engaged and part of a project and even before the project starts, it's really important. So they're part of the decision making too. I mean, food safety is an issue, certainly, and a lot of companies are hesitant to give out food because they're worried about things like that. Here in the US, it's lawsuits, and so you do have to ensure food safety, but it's also important that there be buy-in, I think, among the community that the program or project is intended for.
We have like around 20 people online. Is there any question from the online guests? If you have a question, you can just send on the chat or you can question. And I didn't see any here in the chat, just to make sure that everybody has the opportunity to ask questions. Is there any question more? Yes.
Do you think like being sustainable, like when doing groceries and like making sure you don't overly get stuff is helpful to food insecurities? Like, does that contribute in a positive way?
Yeah, for sure. I mentioned before that food waste is an issue, even for people who might be getting food from food pantries. So that's something we studied, and there has been other research where people they don't give it away, they toss it. And it may be, well, we did a project some years ago at a Boys and Girls Club in Eastern Hillsborough County. And a lot of the kids that attended that club, their parents were agricultural workers, probably including undocumented folks. And there was a weekend food backpack program. And the kids would get this backpack on Fridays to get them through to Monday. And the intent was the food was for the kids. So we wanted to know what happened to the food. And it landed up, it's a really cultural thing too, that the food was shared with everyone. But there was also food that they were getting that they didn't even know. And the really good example of this was canned chicken salad that no one would eat. Because it didn't know what it was, had never eaten it. And so that would be thrown out. So the program needed to tweak in order to reduce the food loss. But so if that's what you're getting at in terms of sustainability, that's, yeah, food loss, I think up to 40% of food in the US is, food waste, food loss annually, huge amounts.
Adding on to the food waste idea, I come from working in restaurants and hospitality, and that I witness it so often, it angers me. Do you know of any like ongoing projects or things or collaborations with restaurants to mitigate that food wasting
It's not
anything?
much. You may want to contact Feeding Tampa Bay because they work with they get food from distributors, but also from supermarkets like Publix and maybe even some restaurants. And I think part of the issue there too is concern about food safety.
Yeah, liability.
Yeah. So,
Limited experience. I live closer to Orlando, so I've worked more extensively with Second Harvest. I don't have as much experience here in Tampa Bay, but with Second Harvest, their donations from Publix by and large are able to be used for their food distribution boxes. But when they have contracts with restaurants, they will use them for same day feeding if they're doing like lunches in for the community for populations.
that's, I think, probably the same with feeding. Yeah.
It's not packaged. You can't give it away if it's not packaged.
I was curious, how do we get involved in the work you're doing?
Well, there's some cards here. You could reach out to me, there's always, we're, waiting to hear on some new projects.